Nowadays, the majority of the follicular lymphoma patients have a very good outcome, and the median overall survival is coming to close to the 20 years. There are, however, subgroups of patients who have a poor outcome. We are able to stratify the patients with a follicular lymphoma according to the different prognostic indexes. It's so-called FLIPI or FLIPI2. And just recently it has been suggested a new index, so-called PRIMA, PRIMA Prognostic Index, which was constructed on the cohort of patients who were treated in the PRIMA study, which was a randomized study focused on the rituximab maintenance. It means that the patients, everybody was treated with the immunochemotherapy, and if they responded, they were randomized to observation and the rituximab maintenance. And this index has been just recently presented, and it's based on just two parameters. One is beta-2 microglobulin, and if its level is higher than 3 milligrams per liter, then the patient belongs to the high-risk group. If it is lower, then it depends on the bone marrow involvement. If the patient has a low beta-2 microglobulin, but he has bone marrow involvement, then he is a part of the intermediate risk of group. And if the patient has normal Bi2 microglobulin and no bone marrow involvement, he has a low risk. What we did in our study is that we have a prospective project we called NiHiL project. It's a Czech lymphoma study group project, and we prospectively observed the patient with lymphomas. And we pick up the patient who fulfill the criteria: follicular lymphoma, histology grade 1 to 3A, treated with immunochemotherapy, it means rituximab plus chemotherapy. And those patients, we had a beta-2 microglobulin information. Altogether, it was almost 1,200 patients, exactly 1,179 patients. And in our presentation, we clearly showed that the PRIMA PI is really very good. It's simply good. It looks like a bit better than the previous ones, prognostic indices. But one of the most important observations we made was that in those patients who are in remission after 2 years from the start of the treatment, and who usually are considered to have a good prognosis, that if we divided these group of patients according to the PRIMA PI, it means high-risk patients versus low plus intermediate risk patients, what we have observed is that the patient with high-risk features, it means a higher beta-2 microglobulin, they have significantly higher risk to die. It means it was a hazard ratio 2.6, so it means, by other words, 2.6 times higher risk to die, although they responded very well and they have been in the remission at the 2 years period of time. So it could have a clinical implication, because then we should consider to treat these patients probably more aggressively than those patients who have low or intermediate risk. So, and this is just the main message of our paper.